Applestosen. It's Dr. Bob here with another health and vitality tip. So today we're talking about shoulder rehabilitation. So the shoulder is the most mobile joint in the body. So you have this full range of motion that you have. You can move the whole entire body around. But a lot of times it comes about because there are imbalances in the muscular system. There's literally about 18 different muscles that move the shoulder in all these different positions across the joint. There's 4 of them, your rotator cuff muscles. So some of them turn the arm in, out, some of them raise them up. Those are the muscles that hold the joint in place. There's not actually a socket. It's this long bone, the humerus, sitting against part of the shoulder blade that creates a socket. So this range of motion should have all kinds of movement to it, but it doesn't actually have a ball and socket joint like the hip. So rehabilitation of the shoulder really begins before a problem develops, because what I see in practice for over 30 years is most of the time it's an imbalance that leads to a tendonitis or bursitis or tenosynovitis. There's all these different itises. Itis is an inflammation in the body. If it goes on for too long, then you have destruction of the joint leading to arthritis. So you can have a muscle coming across the top that can actually affect that, and it can cause the irritation of these little fluid-filled sacs called bursa to give you a thing called bursitis. Unfortunately, the medical approach typically is to inject it, to put some sort of steroid or some sort of anti-inflammatory drug, and not actually correct the underlying problem. For our patients, when we take care of them, we look at their overall posture and their body alignment. If a person has a shoulder tilt to one side, they're going to create a shoulder problem. If the shoulder's up on one side or rotated, they're going to create a shoulder problem. So the key is to get balance to the shoulders so that your head is centered. The nerves and through the neck, they come out and supply all the muscles and the nerve supply down the arm. If you have a forward head position or your head is shifted off to the side, a lot of times this is either poor posture over a period of years, or it's maybe old traumas or injuries that were never ever corrected, even from the early age. Young kids fall down off of bikes, we fall out of trees, we have impact sports when we're younger that can cause problems with the nerves that cause a weakening. Typically the 5th, 6th, or 7th nerve, the last 3 in the lower cervical, affect these areas that go to the shoulder. So the first thing you need to look at is your posture. You need to look at flexibility so that these chest muscles are stretched out, the back muscles are strong, keeping the body upright. The challenge when a person comes in, if they don't use their shoulder, maybe they have an injury, you can lead to a thing called a frozen shoulder. So you have very little movement whatsoever. These can be treated with proper therapy and care, which we do in our office, but the challenge is it takes a long time. So start now with looking at getting flexibility to the shoulders. Get an evaluation. See somebody that can look at your posture and look at the imbalances of those 4 rotator cuff muscles to create a stronger, healthier shoulder. Many years ago, when I first started in physical therapy, before I became a chiropractor, we treated a lot of acute injuries. So if you have an acute trauma to an area, a shoulder, maybe from a football injury or falling off of a bike or slam dunk with a basketball and you strain it, there's times that we should immobilize it, but keeping it immobile for a long period of time in a sling, they used to keep them in, now we want this range of motion. In sports medicine, you want to start to create movement to the joint as quickly as possible because your body heals quicker. So number 1, you got to have good nerve supply coming out of the neck. Number 2, you got to have good posture. And number 3, you have to have good balance to the muscles. And number 4, good strength so that there's equal strength from the front to the back and the side to side. Start now. Look at your posture on a daily basis. If you see a shoulder dropped or your head is shifted, you're going to create a shoulder problem over a period of time. So now is the time to look at preventing shoulder challenges, shoulder injuries, and so you don't have to do a long rehabilitative process. This is another health and vitality tip from Dr. Bob. Until next time, Applestosen.